How does epilepsy impact mental health and depression? Living with epilepsy can be a complex journey that affects more than just seizures. Many people with epilepsy also face mental health challenges, especially depression and anxiety. Research shows that individuals with epilepsy are about 2 to 3 times more likely to experience depression than those without the condition. In fact, between 20 and 50% of people with epilepsy may have active depression at some point, depending on factors like how well seizures are controlled and the type of epilepsy they have. Anxiety disorders are also common, affecting roughly 20% of people with epilepsy, especially in children and those newly diagnosed. Several factors contribute to this increased risk. First, the brain changes that cause epilepsy may overlap with those linked to depression and anxiety, suggesting a shared underlying mechanism. Interestingly, depression itself can increase the risk of developing epilepsy, creating a two-way relationship. Seizures can also cause emotional and cognitive disruptions, which may lead to feelings of frustration, fear, or sadness. Some anti-seizure medications can have side effects that influence mood or cognition, especially during dose adjustments, but even when medication effects are considered, depression remains more common among people with epilepsy. Psychosocial stressors play a significant role too. Living with epilepsy often involves facing stigma, social isolation, and uncertainty about when seizures might happen. Restrictions like not being able to drive or challenges at work can add to feelings of frustration or low self-esteem. These stresses can lead to withdrawal from social activities and contribute to depressive symptoms. Depression can impact quality of life more than seizures themselves, and sadly, the risk of suicide is higher in people with epilepsy, up to 5 or 10 times greater than in the general population, highlighting how serious mental health issues can become. Children and teenagers with epilepsy also experience these challenges. They tend to have higher rates of depression, anxiety, and attention deficit disorders compared to their peers. For young people, fears about having seizures or social embarrassment can be especially distressing. While some individuals have better access to mental health services, many still face barriers to receiving proper care for depression and anxiety, which underscores the importance of integrated treatment approaches. Addressing mental health in epilepsy is crucial. Early recognition and treatment of depression and anxiety can greatly improve overall well-being. Routine mental health screening should be part of epilepsy care, and healthcare providers should monitor mood changes related to seizures or medications. A comprehensive approach that considers both neurological and psychological factors can help improve quality of life. Remember, everyone's experience with epilepsy is unique, and managing mental health requires personalized care. If you or someone you know is struggling, seeking support from healthcare professionals can make a real difference. In the end, understanding that mental health challenges are common in epilepsy can help reduce stigma and encourage more open conversations about emotional well-being.